My name is Alexia, and I'm going to be doing the second part video of the Module 3 article assignment for leadership and management. Part 2 is centered on the article role of occupational therapy in case management and care coordination for clients with complex conditions. It is a 2016 article by Robinson, Fisher, and Brossard. So the first task is to summarize the content. So I essentially read the article. The article is talking about how occupational therapy can support case management and care coordination for patients with complex conditions. So essentially, occupational therapy is going to come in. It's going to bridge these gaps, fill these gaps for the needs of people with complex conditions, because oftentimes, like, we treat patients, but we just leave them on their own. We were like, okay, you're done, we're treated, you've had surgery, whatever, and you're sent off back to your life. But we don't really monitor these people, and they have such complex conditions, and they have so many needs that are never fully addressed. So that is the purpose of this article, is to analyze that and how occupational therapy is going to fit in. So essentially, people with complex conditions, they need several help. They need help from several healthcare professionals. So it's important that we coordinate. It's important that we also have interdisciplinary, multidisciplinary, so that we are effective in our delivery and care to the patients. So occupational therapy is essential to it, because the occupational therapists are uniquely educated and specialized in this role, because in occupational therapy, we focus on the person as a whole. It's very much client-centered. So we also focus on their environment, their health, their overall quality of life, how they participate in the occupations that bring meaning to their life. So when we do that, we also identify barriers, and these barriers can be like ways functional mobility. How do we move around our house? How do we move after? So if we had someone have surgery, we prescribed them some post-surgery medication. What if they're in their bed and they have to use the restroom? How do they get up? How do they move? How do we help them with that? What if they need to take medication? What if that medication's on the counter, so they have to go from bed to the counter, whether that be in their kitchen, their living room, whatever it is? How do they get there? So we have to assess those things in occupational therapy. Another thing we do is part of the IADLs, which is the instrumental activities of daily living. So that can be like medication. Like, how do we manage our medication? Do we have the cognitive ability to do that ourselves, or do we need help from someone? Because sometimes, medication, you have to monitor it. So like, you can take certain pills at certain times. So if I have a medication every 4 hours, but I have another one at every 8 hours, let's not mix that up, So that's an essential part of IADLs. We also have to think about not just cognition, but how do we move? So sometimes it goes far beyond what's our support system. What is that like? Do we have someone that can bring us and take us to our appointments that we need to go? Because obviously you have follow-ups. And those are essential to making sure that the procedure is going the right way, everything's working out, you're not getting some type of infection or you're getting your stitches taken out if you have post-surgery and it's an open wound. So essentially, this article is really marketing, or really selling the idea that occupational therapy is essential to the support of case management and care coordination for clients with complex conditions. The authors also explain how occupational therapy is valuable to interdisciplinary healthcare teams. So in other words, like, we can work with other healthcare professionals to ensure that we are addressing both medical and everyday needs. So we have to have an active role in case management and coordination, because we essentially focus on the quality and the value and the successful outcomes for patients. With that being said, I think they've the authors made a really strong case on why we need to be involved as occupational therapists. It's also like an emphasis on the meaningful occupations that people have and getting them back to their everyday life. Also, they center on the idea that sometimes, like our U.S. healthcare system, we focus on quantity over quality. Well, it's not supposed to be that way, because you want to treat these people and you essentially want them to treat them so they don't have to come back. But sometimes healthcare is a business, so the more we give them back, the more income there is, right? Well, we're kind of shifting our healthcare system to be more of a value of quality, of service to our patients. And then sometimes, with that being said, we have these complex patients with complex conditions that require medical, physical, social, psychological needs. And we have to be able to help them, even though sometimes there's big gaps in our healthcare system, which we're not able to always see them, and some people slip through the cracks. I mean, right now we're seeing a case, but the entire country is seeing a case where we've let someone slip through the cracks, something happened, and there might have been unethical procedures from certain healthcare professionals. It's just an interpretation of what people can see from the case. We're also seeing a bit of negligence, and it's just solidifying the idea that occupational therapy is essential to case management and care management for patients with complex conditions. And most of all, like mental health conditions. Those are very, very complex. So essentially, yes, these authors do a very good job of really pinpointing the need for occupational therapy, pinpointing and marketing, and really solidifying the idea. But at the same time, I agree with these. I 100% agree with this article. I 100% agree with the authors. I think they do a good job of bringing to life these sometimes under-recognized topics, especially with like people. We're not really serving them because we're just like, okay, you're treated, bye. But we don't really follow them through all the way, because you send people, you let them go home, and what happens to them? We don't know, but we already did the procedure. You're not our problem anymore. That's kind of what it feels like, and we want to stray from that. So with that being said, like, yes, I 100% agree with the authors emphasizing the whole person outlook, and based on occupational therapy, obviously, it's very much client-centered. I also agree that we should be more involved in interdisciplinary care. I also believe that we need to be able to work with other healthcare providers. We also need to be able to stay more on top of it. And so I do think, and I agree, and I hope this opens more doors and opportunities for occupational therapists, because we're emphasizing the value, and sometimes not a lot of people know what occupational therapy is. So things like this, where like, okay, this is what occupational therapy is. There is a great need for it. Let's keep pushing it, you know? With that being said, I do think that this article, like I said, is very persuasive, and it's very much like trying to sell this. I wish there was more data, like data with like numbers, like to really show the need for occupational therapy, and whether that could be like talking to other healthcare providers and other professionals, healthcare professionals, like how much do you need OT? Do you see the relevance of OT? Do you see the importance? And have that feedback, and kind of convert that feedback into this evidence and data that we can show, and that we can really, if we meet up with a hospital CEO, like, hey, this is the need for occupational therapy. This is what we need. Can we meet up with insurance companies? Like, you need to be able to accommodate for this because the patients need this. So I would think, that being said, like, going off of that, we're going to say like, okay, well, if we do this, there's less hospital readmissions, there's lower healthcare costs. All that being said, it's just evidence and data to reflect the need for occupational therapy with case management and care coordination. So I 100% agree. I would just suggest there be a little bit more data, but I 100% agree with what the authors are trying to say and convey, because the message is clearly conveyed. There's a desperate need for occupational therapy, and I think and I genuinely hope this continues to open doors and opportunities for occupational therapy so that we can better serve our patients, because I think in years from now we'll see, and once it's fully been integrated, because I really hope it is by then, we'll see a big difference and a big difference in outcomes and successful outcomes for patients, and we'll just be able to solidify that integrating occupational therapy was essential and vital and successful for patient delivery, patient service, patient success overall. So yes, I 100% agree, and I really I'm glad I got into this field when I did, and I'm really happy to be in it. So